Hi everyone, and welcome to A&P with Dr. O. Let's take a look at a preserved kidney specimen. This kidney came from a pig, and the first thing that we will go ahead and do is we'll look at some of the outer structures that we can see, and then we're going to do a dissection. That way we can look at a few of the internal structures as well. The kidney is going to have an outer capsule known as the fibrous capsule. That's what we are seeing here. And then there's this indentation in the kidney, and that is known as the hilum. And once we find the hilum, that's going to help us find our renal vein, our renal artery, and then here we can see our ureter. There's still a fair amount of connective tissue surrounding the ureter. I cleaned a lot of it off just so that we could see it a little bit better, but there is still a little bit of connective tissue that we can see. This though is going to be the ureter, and this is what will drain urine from the kidney down to the urinary bladder. Now, the reason I can tell the difference between the renal artery and renal vein has to do with the differences that we've discussed prior in this class about arteries versus veins. Remember, arteries carry blood at a much higher pressure. Therefore, they are going to have thicker walls. Oftentimes, they're also more rounded. When we look at the shape of that vessel, especially if we look at it underneath the microscope. And then just by touching this vessel and comparing it to the other one, this one is much tougher. If I look at it, it has like a rounder structure to it. And then this one is more thin and flattened. And then that's how, again, I can tell that this right here, this thin flattened vessel is the renal vein. And then this thicker rounded is the renal artery. In order to get a look at the inside of the kidney, we are going to dissect, and we're going to dissect along a frontal or coronal plane. I'm going to go ahead and make that frontal cut now. Now that we've made that frontal or coronal cut, we can see that the inside of the kidney has this outer cortex. So that's what we can see as this outer layer here. And then next we have the inner medulla. And the medulla we can identify by these renal pyramids, these triangular shaped structures that we can see when we dissect. This one in particular, we can really see that triangle shape. And then the tip of the renal pyramid is going to be the renal papilla or renal papillae. That would be the plural term that we would use. Also in between the renal pyramids is where we would have the renal columns. So those would be located between the pyramids that we see, again, making up the medulla there.